Our heart story written in lines and the waves. This is the language of the heart. If you are able to understand this language, then ECG interpretation is very easy for you. But if ECG ever confused you, watch the step facts. All understand about the ECG basics. We have P, Q, R, S, T. P represents the atrial depolarization, means here the atria started to contract. QRS is ventricular depolarization, where the ventricle started to contract or atria started to relax. Then we have the T. T represents the ventricular repolarization, where the ventricle started to relax. Okay, so now the P is for 0.08 to 0.12 second. 0.08 to 0.12 second. Then we have the QRS. QRS should be less than or equal to 0.12 second, or maybe you can say that less than 3 small squares. Then we have QT. QT is 0.36 to 0.44 second, and we have PR interval from 0.12 to 0.20 second. So here we have P 0.08 to 0.12 second. QRS is less than 0.2 second or less than 3 small squares. Then we have T. T is from 0.1 to 0.25 second. So this can be variable. Now PR is 0.12 to 0.20 second, and the QT interval is 0.36 to 0.44 second. So now let's understand in ECG what are the small boxes, large boxes, how to calculate the rate, rhythm, everything. Okay. So before understanding about the ECG, we should know some basics of ECG. So in ECG paper, you will see this type of one large box. One large box is equal to 5 small squares, right? And it has vertical axis and it has horizontal axis. On vertical axis, this signifies the amplitude or the voltage, and on the horizontal axis we have time. So if you describe this is just the small box, right? This small box. Now if we take the vertical size, so if we have this vertical side will take as the amplitude, then we have 0.1 millivolt. In a small box,